Hi, folks. My name is Greg Turner, the Radiology Coach. My job is to demystify the enigmatic world of X-rays. In this age of search engines and phone apps, we can find basic information on virtually any topic. We have access to expert opinions, research, and trade secrets literally within a keystroke. This is extraordinary because of the easy exchange of information, and yet it is also volatile due to the propensity to distort this information when proper context is not applied. Physicians attend 4 years of graduate school in addition to their 4 years of undergraduate study. Afterwards, they invest years of interning and fellowships to master their trade. Radiologists, or specialists who interpret X-rays, have undergone this training, and once they achieve their designations, they are the go-to docs for proper interpretation of X-ray images. The point of outlining the qualifications of these specialists is simply to remind the public that if interpreting X-ray images were easy, there wouldn't be an entire segment within the healthcare industry dedicated to it. Looking at an X-ray can be a lot like watching a cricket game for the first time. You might have an idea of what is going on, but in order to follow the game, you must first learn the rules and basic principles. Effective radiographic interpretation relies on the foundations of anatomy and physiology and pathology. Additionally, due to hundreds of congenital defects and physical anomalies, doctors must rely on their experience, training, and intuition to accurately interpret images. It is not uncommon for healthcare facilities to resist allowing patients to review their X-ray images. Facilities are more cooperative to providing physician interpretation results. The reason for this is that when patients try to read their own X-rays, it can result in a type of Pandora's box outcome. Now that we've put this all into context, when a layperson is looking at their X-ray, they must first have a basic understanding of the anatomy that is included in the image. As an example, in a chest X-ray, we can easily visualize the lungs, heart, ribs, scapulae, shoulders, spine, and diaphragm. Next, the person must understand what markings in the X-ray are normal versus abnormal. In a chest X-ray, the bronchi markings, aortic arch, and gastric air are all normal findings, but to a layman, these shapes can induce fear and dismay. Even the overlapping of ribs in a chest X-ray can cause consternation to the untrained eye. Additionally, fluid can dangerously collect in the lungs, but there are some circumstances where this shouldn't warrant an alarm. When radiologists identify a suspicious marking on a chest X-ray, they may refer back to the patient's previous X-rays to compare. The new X-ray may actually show an improvement from previous exam. Patients may have conditions that predispose them to these types of appearances on their X-ray. For example, cystic fibrosis is a disease that completely changes the appearance of one's chest X-ray. Therefore, a physician's assessment is necessary to ascertain their current state. Obviously, a patient's history is important in identifying problems with their exams. It is an understatement that each patient is evaluated according to their own backdrop and story. Physician assistants are trained to read films, typically within their specialties, and their interpretation skill sets mimic that of their superiors. Radiologic technologists are skilled at identifying quality radiographs, and they can often use their knowledge of pathology to optimize the images for more accurate results. Nurses identify subtle changes within their patients' X-rays, and they can determine tube and line placements. When it comes to additional modalities such as MRI, CT, nuclear medicine, and fluoroscopy, diagnosticians are further required to leverage their knowledge of cross-sectional anatomy, pulmonary and lymphatic physiology, and chronic disease processes. X-rays are a spectacular tool within the medical industry. When combined with the proper knowledge and experience, their applications are limitless. Physicians, chiropractors, and DOs continue to refine their skills in interpreting studies within their respective specialties. And radiologists are a prized asset in the diagnostic process, and their value should never be taken for granted. As far as your average Joe learning to read X-rays, you have probably figured out by now that mastering interpretive techniques is a tall order. and requires a bit of education and experience to become adept at it. That concludes this episode of Can Anyone Learn to Read X-Rays? If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the Radiology Coach. And remember, mark my word and mark your films.